This baby is just 1 day old. His aunt tells us it's too soon to name him, as he's fighting to survive. So is his mother, who's still recovering from complications during childbirth. Pakistan is one of the most dangerous places to give birth and has one of the world's highest infant and maternal mortality rates. Every second counts here at the Women and Children's Hospital in Abbottabad, and the clock is ticking. Dr. Raheel Shahzad, the Deputy Medical Superintendent of the government-run facility, shows us around. Every hallway we walk through and every corner we turn, we see women crowded together, waiting in dimly lit corridors that are packed to capacity. It's already overcrowded, and Dr. Shahzad warns it could get worse. He's expecting a spillover of patients who once relied on US-funded maternal health programs. That's after US President Donald Trump announced a funding freeze in January. The UN says that around 60 maternal health clinics have already shut down across the country, and more are likely to follow.
Of course, असर पड़ता है इस फंड का क्यों नहीं पड़ता अगर ये फंड होते तो हम और बेहतर सहूलत मुयस्सर कर सकते थे.
Despite his optimism to cope, it's overwhelmingly apparent just how underfunded this facility already is. The lights go off as we film, but doctors, nurses and healthcare professionals continue to work. This is the reality of free healthcare in Pakistan. Around 80% of people pay for private services, leaving only the poorest and most vulnerable with no choice but to rely on government facilities or international aid projects. An hour south of Abbottabad in Mansehra, we visit one of these aid projects, a maternal health clinic that was once supported by USAID. It's not easy to find the building. Since the funding cuts, the clinic has had to remove its sign, which featured the USAID logo, making it hard for people to tell it even exists. But it is here, and it's here where we meet Sophia Bibi, a mother of 5 who says she does not know where she will go if the clinic shuts.
हम इस बाजी के पास आते थे तो इनसे हमें मेडिसिन भी मिल जाती थी और अच्छा मशवरा भी मिल जाता था. अब 4 माह से ये प्रोजेक्ट बंद है तो ये बाजी भी बंद करना चाह रही हैं क्लिनिक, तो हमारे लिए बहुत मसला होता है. दिसंबर में मेरी डिलीवरी हुई थी, इधर ही मैंने करवाई थी बाजी से. मुझे सारी सहूलत मिली थी और बहुत अच्छे तरीके से मेरी डिलीवरी हुई थी. तो अब इससे आगे हम कहते हैं क्या पता किधर जाएंगे, क्या होगा हमारे साथ.
Shella Rani is the lady health visitor in charge. She relied on the project for her own medical training and to obtain essential supplies for her patients like clean delivery kits.
तो इधर मैं काफ़ी अर्से से काम कर रही हूँ. मैं ख़ानदानी मनसूबबंदी, माँ और बच्चे की सेहत के बारे में डिलीवरीज़ भी करती थी और फैमिली प्लानिंग, ये सारा बच्चों की सेहत के बारे में भी उनका चेकअप करती थी. क्योंकि USAID की तरफ से हमारे पास फ़ंड था, हम करते थे. साराबाजी आती थी, वो पेशेंट लेके मतलब ख़वातीन को भेजती थी. पहले 300 से 400 तक पेशेंट आते थे, लेकिन उसके बाद जब ये ख़त्म हो गया, USAID ख़त्म हो गया, मतलब ये प्रोजेक्ट बंद हो गया, तो उसके बाद हमारे पास पेशेंट कम हो गए.
We're going to show you inside the room where Shella would do everything for women. Women would give birth on this table. Shella would then place the babies onto this bed, and Shella even offered ultrasound appointments to women. This was a vital hub for women of this community who weren't able to get to hospitals. The UN warns the US funding cuts in Pakistan will leave around 1.7 million people, including 1.2 million Afghan refugees, without access to vital maternal health services. And in Haripur, home to one of the country's largest Afghan refugee camps, that impact is already being felt. Mothers like Rahana, who have very little money, depended on a maternal clinic funded partially by the United States and run by the government. She gave birth to her son there in December, just weeks before the funding was frozen.
زما پهله ماشوم چې دی په پرایویټ هسپتال کې شه دی او زما د دوه ماشومان چې دی دا دغه NGO والا هسپتال چې دی د ځای کې شه دي और मुंगा चदे कने माचित चाना और दिदली चदे दे अस्पताल का खर्चा दमरने की दगने की सुंदर मुंगलाडलु बिया हालता आगे जाए कि समागदा माशूम चदा आगे जाए कि शेदा अन माता चे पता चदी दागे अस्पताल वालों मुंगला देर खष्ट सहूलत राको और देर दगाओ को 9 म्याश्ती मा इलाज मगे जाए ना करे दे चे माशूम चे टाइम सख्त पैदाइश का टाइम आगे जाए कि पैदाइश टाइम मने मुंगा माशूम का हालत पैदाइश करे दे ना ये अस्पताल वालों माला देर खष्ट सहूलत रा कर दे बाजीगानी हुंडे खष्ट तरीके से पेश रा करियो और ये माता दुईगानी खष्ट रा करियो आगे जाए दगा दे अस्पताल का देर खला को और सफाई हुंडे खष्ट तरीके से रवा बिया ये माता मुझे माशूमान और फैमिली प्लानिंग बारी की हम आगाई रा करे बचे दासी की दगा की और बस दगा.
That clinic used to operate 24/7. Now, since the cuts, the government can only afford to open during the day. But childbirth doesn't follow a schedule. It can happen at any time. For pregnant women who live in this refugee camp, the struggle is constant. They fled war, they face the looming threat of deportation, and now they must confront the real possibility of giving birth without adequate care. The clinics that helped vulnerable women like Rahana and Sophia are on the brink of closure. And while the Pakistani government is trying to fill the gap, it's a huge undertaking.